Healthcare. What should we be doing and how should we be doing it?
It's a mess. It's a mess. There are many levels, many tiers we can deal with. Why do you think, in part, there's very little psychiatric treatment in this state, in Las Vegas? There are psychiatrists, but they won't work in the areas that they need because they say there's not enough money.
Right.
It's great. Now,
And addiction is the same way.
that's right.
And if you're an addict and you've got the money, you can get help.
And Medicaid, for the most part, does not cover that.
That's correct.
And that's one of the reforms that are needed. Let's look at who has insurance of one sort or another. Military, covered. Organized labor, covered. If you're on Medicaid now, where age is not an issue, covered. Medicare, covered. Who really isn't covered? The way our system worked, good or bad, is that the employer would pay for that as a fringe benefit. That is the problem because it's so expensive. I mean, I know, and you know, how the cost of medical care and prescriptions have gone through the roof. I'm on Medicare. I presume you're on Medicare too. It's required. Portability. If you're on Medicare, Medicare is partially federal on traditional Medicare,
right,
and a lot of it's state. HMOs. Did you realize that if you're on an HMO and you have an illness and you're traveling to California, Illinois, New York, you're not covered except for an emergency?
Exactly.
Why is that? It's ridiculous. People are saying, let's have Medicare for all, let's have more socialized medicine, things of that sort. If we want to try something on an incremental basis, here's what I suggest. Pharmaceuticals, all right? Why not have, under Medicare, free pharmaceuticals? If you have an HMO, it's included, the Advantage plan.
Right.
If you're on a traditional Medicare, it's not.
Right.
Why is that?
So what do we do?
Well, for example, we should allow competition in pharmaceuticals, including importation. You can look at things like Trulicity or other medication that will say made in Germany, made in Croatia. You know the cost of living in those countries, the product does not cost that much.
That's right.
But here, you'll spend Trulicity $200 for one dosage when it might cost them $15 in other places. It's a ripoff.
Of course it is.
And you have to ask yourself, who is benefiting from it? There's no question that pharmaceuticals are big business. They're to make money. What I think
half of the ads that you see on television are for pharmaceuticals.
That's right, but you know what they're doing, and I don't agree with it. They're not selling it to the doctors. They're selling it
they're selling it to the patients.
so you can pressure the doctors to get it. Right?
Doc, I saw this on TV. You got to give this to me. Sounds good.
I appreciate it.
Steve, I appreciate you coming in.